Protect the small blood vessels. Support eyes, kidneys, brain, and nerves naturally. The hidden key to eye, kidney, brain, and nerve health. The silent damage we don't see. Friends, many chronic diseases do not begin in the heart. They do not begin in the brain. They do not even begin in the organs we worry about. They begin quietly, silently, in the smallest blood vessels of the body. These tiny vessels, the microcirculation, supply the retina of the eye, the filtering units of the kidney, the fine vessels of the brain, the delicate nerves in hands and feet, even the inner lining of arteries. When these microvessels become damaged, stiff, inflamed, or blocked, disease begins to unfold. Before, vision problems, kidney dysfunction, neuropathy, cognitive decline, hypertension, vascular stiffness. There is microvascular injury. This damage is silent. No pain, no warning, no symptoms. But science shows, if we protect the microcirculation, we may slow, prevent, and sometimes even reverse early dysfunction. Today we discuss a simple but powerful support strategy. Benfotiamine, methylcobalamin, B-complex. These nutrients work not just for nerves, but for whole body vascular protection. The three major causes of microvascular damage. Modern metabolic stress damages small vessels through three main pathways. 1. Glycation damage, sugar injury. Excess glucose damages vessel walls and forms. Advanced glycation end products, AGEs. This causes retinal vessel injury, kidney glomerular damage, nerve ischemia, arterial stiffness. 2. Homocysteine toxicity, elevated homocysteine, damages endothelium, increases vascular inflammation, reduces nitric oxide, promotes stiffness. 3. Endothelial dysfunction. The inner lining of vessels loses elasticity, vasodilation, microcirculation control. These three processes quietly reduce perfusion to vital organs. This is where targeted nutritional support becomes meaningful. Benfotiamine, protection against sugar-mediated vascular injury. Benfotiamine is a fat-soluble form of vitamin B1 with strong microvascular benefits. It blocks age formation, activates transketolase pathway, reduces oxidative stress, protects endothelial lining, improves microcirculation, organs that benefit, retina, eye, kidney glomeruli, peripheral nerves, brain microvessels. Benfotiamine essentially shields small vessels from metabolic stress. Benfotiamine, protection against sugar-mediated vascular injury. Benfotiamine and blood pressure, supporting vascular tone. Beyond microvascular protection, benfotiamine also supports long-term blood pressure regulation through its effects on vascular biology. It reduces advanced glycation end products, AGEs, that stiffen arteries. Improves endothelial function. Reduces oxidative stress in blood vessels. Supports arterial elasticity and compliance. Over time, these effects may reduce arterial stiffness, improve pulse pressure, support more stable blood pressure regulation. Benfotiamine does not act like a drug that lowers blood pressure immediately. Instead, it improves the quality of the blood vessels themselves, allowing the body to regulate pressure more efficiently. In essence, better vessel health, better pressure control, systemic benefits, whole body microvascular support, endothelial health, the common link in chronic disease. The endothelium, the inner lining of blood vessels, is one of the most important yet overlooked systems in the body. When endothelial health is impaired, blood vessels lose their ability to dilate properly. Inflammation increases. Oxygen delivery decreases. Microcirculation becomes inefficient. This dysfunction is now recognized as a central mechanism in many chronic diseases, including hypertension, diabetes, kidney disease, neurodegenerative disorders, cardiovascular disease. Even in conditions like cancer, the role of microcirculation in the vascular environment is increasingly recognized. Tumor growth depends on blood supply, angiogenesis. Poor microcirculation can lead to hypoxia and abnormal cellular signaling. Chronic inflammation and endothelial dysfunction create a favorable environment for disease progression. Supporting endothelial health helps improve oxygen and nutrient delivery, reduce inflammation, maintain cellular balance, support normal tissue function. Many chronic diseases are not isolated organ problems. They are vascular problems at the micro level. Methylcobalamin. Restoring endothelial and neurovascular health. Methylcobalamin, active B12, supports nitric oxide signaling, homocysteine reduction, nerve blood supply, endothelial relaxation. This improves microvascular perfusion, vasodilation, brain circulation, retinal oxygen delivery. It acts at the level of vascular signaling and nerve vascular interface. B complex, B6 plus B12 plus B1. Homocysteine reduction and vascular support. B complex supplements provide B6 reduces homocysteine, B12 endothelial repair, B1 metabolic vascular protection. Together they reduce vascular inflammation, improve arterial elasticity, support microcirculation, protect organ perfusion. How these work together, a synergistic microvascular strategy. This combination covers three major pathways. Benfotiamine blocks glycation damage. Methylcobalamin improves endothelial function. B6 from B complex lowers homocysteine. Together, reduce vascular inflammation, improve capillary blood flow, protect small vessels, support organ perfusion. This is whole body microvascular protection. Eye health, supporting retinal microcirculation. The retina depends on extremely delicate capillaries. Microvascular support may improve retinal perfusion, reduce glycation injury, support optic nerve metabolism, protect small vessel integrity. This is important for age-related retinal stress, pre-diabetes-related microvascular changes, visual fatigue, early vascular retinal decline, kidney health, protecting the glomerular filters. Kidney filtration units rely on tiny vessels. These nutrients may reduce glomerular oxidative stress, improve endothelial function, protect filtration membranes, support renal microcirculation. This is meaningful for early vascular kidney stress, metabolic syndrome, long-term renal preservation, brain microcirculation, supporting cognitive perfusion, small vessel health effects, memory, clarity, mental energy. Neurovascular coupling. Microvascular support may improve cerebral blood flow, reduce vascular stiffness, support neuronal metabolism, protect small vessel integrity, peripheral nerves, neurovascular support. Nerves depend on microcirculation. Benefits may include improved nerve blood supply, better sensation, reduced ischemic nerve stress, myelin support. This is why these vitamins are often used for neuropathy, nerve fatigue, microvascular nerve dysfunction. Systemic benefits, whole body microvascular support. This combination supports eye health, kidney health, brain circulation, nerve perfusion, endothelial function, arterial flexibility, microvascular integrity. It is not just a nerve supplement. It is a microvascular support strategy. Morning, methylcobalamin, sublingual. With meals, Benfotiamine. With breakfast, B-complex. This provides baseline vascular support, post-meal vascular protection, homocysteine control, endothelial function support. Conclusion: protect the small vessels, protect the organs. Friends, health is not only about treating disease. It is about protecting the systems before damage appears. The smallest vessels in the body determine vision, kidney function, brain clarity, nerve vitality, vascular flexibility. When we protect microcirculation, we protect the future of our organs. Benfotiamine helps shield vessels from metabolic injury. Methylcobalamin restores endothelial signaling. B-complex reduces homocysteine stress. Together they form a quiet but powerful foundation for vascular health. This is not dramatic medicine. This is gentle, steady protection. Sometimes the most meaningful interventions are not aggressive. They are consistent, supportive, and physiological. Protect the microcirculation, and you protect the organs. Support the smallest vessels, and you strengthen the entire body. When we support the endothelium, we are not treating one disease. We are supporting the biological foundation of health itself. This is the science. This is the opportunity. This is preventive vascular care at the cellular level. Founder. Holistic Wellness Foundation. IMFAL. Healing beyond boundaries.